Welcome, Greek U Nation, to episode 503 of the Fraternity Foodie Podcast. I'm your host, Mike Ialon, CEO of Greek University. I'm a speaker and an author. Our fifth book just came out. It's called Perseverance and How to Be a Great Fraternity or Sorority Alumnus. So go and pick up that book on Amazon or Barnes & Noble today. We call these episodes the Fraternity Foodie Podcast because there is nothing like great food to bring college students together. Fun fact, emergency room doctors are a big hit with our college students. This semester, Dr. Louis Profeta spoke at Florida State, Clemson, Virginia Tech, Florida International, and even the University of South Carolina. So today I decided that we need to get another ER doctor on the show with tons of personality to keep this energy going all semester long. So let me introduce you to our next guest. Dr. and Colonel Josh McConkey is an award-winning, best-selling author and an esteemed emergency physician with over 2 decades of clinical experience. He served as professor at Duke University and maintains board certification in emergency medicine. With 22 years of military service, Dr. McConkey now commands the 459th Aeromedical Staging Squadron in the U.S. Air Force Reserves, demonstrating exceptional leadership and dedication. Beyond his medical and military achievements, Dr. McConkey has been recognized for his contributions to education and community. He was honored in 2022 with induction into the Alliance, Nebraska Public Schools Hall of Fame, and received the 2023 Distinguished Alumni Award from Chadron State College. A devoted father of 3, his greatest passion lies in shaping future American leaders alongside his wife, Elsa, in Apex, North Carolina. Welcome to the show, Dr. McConkey.
Thank you, Mike. Pleasure to be here. You have a great show. I got to listen to an episode on the drive from DC the other day. It was fantastic.
Well, thank you very much. I appreciate that. We love it when listeners get a chance to just learn more about the show and then actually get to be a guest on the show. That's the best part. So I appreciate that. Thank you very much. You know, I'm just kind of creating what I needed as an undergraduate student to learn more about all kinds of things that impact college students. So we are very lucky and very fortunate to have you on the show today. And, you know, I wanted to talk a little bit about your undergraduate experience because you chose Chadron State College for your undergraduate experience. And for our listeners that aren't familiar with Chadron State, it's a small school in Nebraska. They have roughly 3,000 students. So why did you decide on Chadron State?
Yeah, it's a small Division II school. And so for college football fans, and NFL fans, Danny Woodhead would have been the most recent graduate from Chadron State, 2-time Harlan Hill Trophy winner. And then Don Beebe, a longtime player with the Buffalo Bills and Green Bay Packers. I had multiple scholarship offers. I think ROTC. I had offers at USC, Oregon, and Marquette were what I narrowed it down to. But I got a very unique scholarship for a Rural Health Opportunities program. It's called RHOP. And that kept me at Chadron State College, which was the whole purpose of the program, right? They wanted to keep kids in Nebraska, and it kept me at Chadron State. And it was about an hour from home, so I grew up in Alliance.
Yeah. Okay. That makes total sense. I guess the program worked because it kept you in Nebraska.
Yeah.
You could have gone anywhere in the country, really, but it worked. So that's really cool. All right. I love it. I have to visit Chadron State. I haven't been there yet.
Yeah.
It's definitely on my list.
They'd love to have you out there.
Hey, listen, I'm just waiting for the phone call. If they call me, I'm there tomorrow. I promise you.
Right.
I love it. And you know what? You have 22 years of military service. So first and foremost, thank you for your service to our country. And now you command the 459th Aeromedical Staging Squadron in the U.S. Air Force Reserves. Tell our audience, what made you decide to go into the U.S. Air Force?
I've always been a big military history buff. You know, I'm not an old guy, but I was born in 77. So, you know, I kind of lived in the shadow of the Vietnam War my entire life. I grew up watching Platoon and Full Metal Jacket and always had a tremendous amount of respect for those in the military. I joined the Army right out of college. I got a commission into the medical corps. I was medical service corps for a while when I went to medical school and served in Iraq in 2007. It scared the hell out of me. So I switched over to the Air Force when I got back.
Yeah. I listen, I can only imagine what that's like. You know, I've never served. Certainly my father has served in the military and he's told me some of those stories. And yeah, I think some of the stories I heard from my dad just scared the hell out of me, and I'm like, "Oh my god, like what are we getting into here?"
Yeah.
So I certainly understand that, but listen, I appreciate everybody who serves, so thank you for that. And you're also an emergency physician with over 2 decades of service in the trenches of America's emergency rooms. Talk to our audience about mental health because I'm wondering how are we going to fight this mental health crisis that's plaguing so many young people today.
Yeah. As an emergency physician, that's why people love emergency doctors, is I have a bunch of crazy stories, people putting things where they shouldn't be. I've got all kinds of funny stories. But on the more somber side of things, as an emergency physician, what I've seen in the last probably 5 to 10 years is just a rampant mental health crisis, anxiety, depression, suicide. This generation of young Americans that they got shut out of schools. They were shut out of their churches. They spent 2 or 3 years, those very formative years of their life, on telephones and iPads and having no social interaction. That has mental health effects that we're seeing right now. So it's a huge crisis, and that's something that we all have a part in trying to fix.
Yeah. I mean, it's going to be fascinating to really learn how the pandemic has impacted this
Mhm.
generation. I'm sure there's going to be plenty of studies and people are going to
Yeah.
look at, what happens when somebody spends a couple of years in isolation, only on their devices and not having any kind of social interaction with other people.
Yeah.
Yeah, I agree with you completely. I think there's going to be impacts for many, many years to come. The other thing I'm thinking about too is the holidays, speaking of mental health.
Yeah.
It's right around the corner. We're starting to get into that Thanksgiving holidays and Christmas. How do we avoid all of these 911 calls that
Yeah.
always come during the holidays?
So the strange things that I've seen over the holidays, everyone's excited. For a lot of some people, it can be more somber moments as well when they've lost family members and it reminds them. But generally, everyone's having a good time. They're drinking a whole bunch. So a couple of tips there: chew your food, cut it into reasonable pieces. I can't tell you how many holiday choking events I've seen. I literally spent one Christmas, had an entire family packed in my ER. They had just had grandpa choked on a big old chunk of steak. I can't remember what it was, but he did not survive. And I had to walk into that room on Christmas Day, and just the entire family is sitting there. Like, geez, cut your food into reasonable bites and chew it. I've seen several of those choking events. It's pretty crazy. When you look at other things with the alcohol use, just moderation. Like, I know my family included. I had a Thanksgiving probably about 3 or 4 years ago. Um, there was a drunk uncle moment with some of my family members, and I had to use that as an opportunity to teach my kids that we don't talk like that, and we don't drink that much alcohol. So the alcohol in moderation is always one, and then the infectious illnesses. So leave the diarrhea at home. I have 16 nieces and nephews in my family, and invariably one of them comes in with vomiting or diarrhea, or had just gotten over it, and then it runs rampant. So 2 years ago, the entire family had vomiting and diarrhea. I spent Thanksgiving on a toilet. So
Ugh, I am so
those are the
sorry. But you're
oh
right. I mean, those things, they just kind of run rampant. And
man.
suddenly you're like, what just happened? And it's
Yeah.
always the same story. Somebody
Oh,
wasn't feeling
jeez.
well, ended up coming to the holidays, and then infected everybody in
Yeah.
the house.
People are probably
So
more mindful now with COVID,
yeah.
but still, leave the diarrhea at home, people. Okay, please,
Yeah,
please.
if you're not feeling well, just stay home. Like there's going to be
Oh,
another, holiday meal right around the corner. Just
mhm.
stay home. Do yourself a favor. Help everybody else. I mean,
Yeah,
come on. All right.
man.
So, since we're talking about, COVID-19, and I agree with you. There's huge mental health impact. So, how do we teach leadership skills to this generation that was so impacted by COVID-19 in terms of their overall education? Many of them were going to class
Mhm.
online, and even small things like graduation ceremonies that never really happened for them.
Yeah, that whole generation just completely cheated. And there are, so just you saw last year, there is an entire cohort there. They missed out on their high school graduation. And then for some other events and riots and things, they missed out on a college graduation. And you look at some very two formative events in a young person's life. That's not fair. They just have been cheated. So just the very basics of getting people to engage in their communities. And so getting started early, the business leaders, coaches and teachers, like the best resource that we have in this country is people. That's what sets us apart. Teachers, coaches, volunteers, and families. We got to harness that resource. Coach Little League, coach T-ball. I have seen a lot of college kids get out there. When I was in college, I refereed some high school sports. I did soccer. Just get out there, get involved and coach and teach. Those are kind of real basics like there. The more you engage your community, the more you're kind of getting it out of that shell and develop some of those skills. That's one place to start.
Yeah, I like that a lot. I think you're absolutely right. I think it's all about engagement. And I think, the same thing is true for college students today. Really, the value of college is the network that you're building.
Mhm.
And so I want you to get engaged. I want you to get engaged. There's tons of student organizations out there, probably 1,000. Find
Oh,
one, just one to get
mhm.
involved with. And especially, I want you to focus in on that community service component
Yeah.
because all of us are extremely privileged to go to some of the finest institutions in the country. And so we have an obligation to help other people in our community. It is our job to extend a hand and make sure that we are lifting people up with us. That is our obligation. And I think, the more you get involved in your community, the more you give back, I think the better you're going to feel inside.
Yeah,
Okay.
it will, and it does that. It helps define your self-worth,
Mhm.
instead of it being tied to social media or even some other social status. You realize that what you do every single day matters. These
Mhm.
kids look up to you. They learn from you. You're like a hero to them. So the more you get engaged out there, you're going to start to realize what your self-worth is really about and what you have to give your community and people around you. You grow as a person.
I totally agree. And I want you to spend time reflecting on that service opportunity after you're done, like immediately after you're done. Go grab a journal and just start writing about what that experience was like. What did it feel like when you were doing it? How did you help your community? And really just start writing. And if you're doing it with a group, with a student organization, get into a circle and start asking these questions and start listening to what it means to other people in your organization to go out and do that community service. And I'm telling you, it'll change your life.
Yeah.
So really, spend some time there. I think in college is a great time to start thinking about how you can help your community because that's really all we have is each other. We're all dependent on other people. Dr. McConkey over here, he's a doctor. He helps to heal people in the emergency room, but he also depends on farmers to go out and get food and other
Yes.
things. Like we can't do everything, right? We
Nope.
only have one little niche, but we're dependent on everybody else in order to survive. So I think the more you start thinking about that, the more you realize that it's our obligation to help other people out. Now, also, I know you like to travel quite a bit, and I also love traveling as well. How can you be a savvy traveler to ensure that you don't become a target for trouble
Yeah.
while you're traveling in some other country, for example?
Yeah. So as a military member, I've obviously traveled quite a bit. I lived overseas in Australia and New Zealand. When I left the service, when I left the army, I actually moved overseas, just try to get my head straight. You know, um, Saw a lot of crazy stuff. I needed to settle down and played soccer at Rotary United.
Nice.
But there's some very easy tips out there that unfortunately there's just people that will target Americans depending what part of the world that you're in. So some very simple things is don't wear the professional sports team jersey overseas. Okay. So the Lions, the Seahawks, Michigan, whatever university you're going to, those things really set you out there. So you won't see a lot of people overseas wearing those. If somebody's out there in a big USC jacket and t-shirt, they're reasonably assured you're an American. So how you dress matters. So the logos, yeah, kind of keep those at home. Number two, just be traveling with people. So when you're solo, you're easy to pick out. If you put that combination of, you're out there solo or you're wearing your sports team hat and then you have a couple of drinks, you are exceedingly high risk. So just have a buddy system, travel with people. And the last one, I've learned this one, carry a dummy wallet. So a dummy wallet with some expired cards, 20 bucks in there, just something so it's not so obvious. It looks like it's real. There's just certain regions of the country. I was in South Africa for the 2010 World Cup. The first night I was there, two British guys, they were at my hostel, got knifed and their wallet stolen. So, you try to be safe, but sometimes you'll find yourself in some bad situations. It's not worth getting stabbed. Just hand them the dummy wallet. They're not going to sit there and pat you down and do a strip search. All right. Hand them the dummy wallet and move on, and everybody's happy.
Yeah, well, that's some really, really good advice, and I'm sure
Yeah.
a lot of the college students really hadn't thought about yet. So I'm happy that you said it because I think that's wisdom that you can impart to other people to help keep them safe. That's really, really important. I want to talk about your book. You wrote the book. It's called "Be the Weight Behind the Spear." What would our student listeners gain by picking up your book?
Some of those basic skills that they may have missed out on just because of what happened during this COVID years, this COVID generation. Just simple accountability, taking ownership. If there's a lot of sports fans out there, Coach K, the Coach Krzyzewski at Duke University, the basketball coach. So when I was at Duke University, he gave a leadership talk to our residency program. I thought it was going to be like a recruiting stunt because it was recruiting season, but it was 2 hours of just pure brilliance and the stories that he told of just like the 2008 Olympic team, of how he created ownership in that team. So he literally starts off with these guys are making 30 or 40 million dollars a year. Is it Kobe Bryant, LeBron James? I mean, these huge names, and we all know these people. Like,
Mhm.
how do you bring a team like that together? So he takes the whole team out to Ellis Island, and he has them do research, a little research paper, find an ancestor or an immigrant. And when they found that, he sits them on Ellis Island looking up at the Statue of Liberty. He plays the national anthem. And literally, when that ends, he's like, when, not if, we win that gold medal, I want you to think about this person, because the next time you hear this song, you're going to be a gold medalist for this country. I mean, it gives me goosebumps. He exuded such leadership. It's crazy. So there's just some great stories in there on accountability and ownership and leadership. If they haven't had that before, I think they're going to find a lot out of it. And there's some great stories for some, very influential, Americans that they can learn from.
Yeah, well, no question. Coach K is an incredible, incredible story of leadership. And you're absolutely right. I mean, how do you get these superstars that are being paid millions and
Yeah.
millions of dollars to play together as one unit
Yeah.
unselfishly for their country? I mean, what?
Yeah.
Like, how in the world do you get that done? But he got it done, sure
That
enough. I
definitely one
mean,
of the coolest stories I've ever heard. And just
yeah.
seeing him, it was they wouldn't let you record it. I was trying to record, so I just was feverishly taking notes, and I used a lot of that in my assumption of command speech when I took command as well.
Yeah. Wow. That's just incredible. What a great opportunity and something you're going to remember for the rest of your
Oh,
life. There's no question
yeah.
about that. I also wanted to talk to you a little bit about this opioid crisis that we have
Mm,
here in this country. My team at Middle Tennessee State University, we've implemented a bunch of initiatives right here in Tennessee, and we're seeing slow progress. It almost seems like we've kind of plateaued for a while. Overdoses were increasing every single year, and now it seems like we've kind of plateaued, and so we're seeing a slowing in progress and reducing those overdoses. We implemented a diversion center in Lebanon, Tennessee. We've had various stigma reduction campaigns that have worked really
mm,
well through billboards, through training on MAT for law enforcement, so that way they understand what MAT is and how it helps
yeah.
people with substance use disorder. So, how do we get out of this mess of this opioid crisis in this country?
So the first part of that is an emergency doctor who has seen just hundreds, if not thousands, of overdose deaths. Rips my heart out every single time. And they're doing a lot better job of the education side of things. Narcan, having some of that more readily available. I mean, those are kind of some public health urgent things that can really save lives now, but you have to address it from the overall arching picture. We didn't always give opiates for pain. Now, if you have terminal cancer, if you've had a surgery or something real significant, I mean, opioids may be a good choice for you. But so much of that pendulum where everyone was being pushed to give opiates for every little bit of pain, life is not a pain-free state. You know, when you sprain your ankle, you've torn some ligaments, and when you step on that sprained ankle, your body is telling you, stop, don't do that. So your body's designed that way for a reason. It doesn't mean that you take an opiate to make it feel better and not have that pain. Stop doing it. Like your doctor has generally told you to put on a splint, use crutches, don't bear weight. There's the pendulum in the late 2000s. We're getting much better now, but everyone was being graded on satisfaction scores for your healthcare providers. And people were literally just bribing patients and giving them opiates for even the smallest amount of pain. I saw an opiate given, when I came out of residency in 2006, 2007, for a patient who had some ear pain. The emergency doctor was so busy, he didn't look inside the ear. He gave the guy an antibiotic and some oxycodone and sent him on his way. He came and saw me about 3 or 4 days later. I looked at his ear. He had wax in his ear. I pulled the wax out. It wasn't an ear infection. He didn't need a narcotic. When you take a narcotic, that medication literally increases your risk of death. So I used to teach at Duke University. So when I talk with the residents, opiates are the only medication that we give that increases risks of mortality for a non-life-threatening condition. You will not die from pain. It hurts. So hey, if you've got terminal cancer, it's a totally different story. But generally, like, life is not a pain-free state. There are other options. We don't need opiates for everything. So the more we get away from even having these in the population, or using them more safely, they're very dangerous. Don't ever keep those in your closet, or keep them in your medicine cabinet. I mean, just kids get a hold of those. It's super dangerous, large overdose potential. You wouldn't leave a loaded gun, sitting in your cabinet, would you? Just think of that with these medications. They're a loaded weapon. They're going to kill somebody. So the less of those we have out there, the better.
I agree with you wholeheartedly. The less we have out there, the better. And you're absolutely right. I mean, even if it's just like sitting in your medicine cabinet, you might be thinking, okay, this was prescribed to me 2 or 3 years ago, and it's just
Mhm.
sitting. The rest of the pills are sitting there in my medicine cabinet. What possibly could happen? But you have no idea who potentially could get into it. It could be a kid, a niece, a nephew that you have running around your house. It could be even, sometimes you have a plumber or somebody who cleans your house. And
Yeah.
guess what? Suddenly pills start disappearing and you're like, wait a minute, I haven't touched that bottle ever since I
Yeah.
got it 3 years ago, and suddenly it's empty. Like, well, how did
Yeah,
that
they
happen?
yeah, they have the high street value. I mean, 20, 30, $40 a pill, based on the pill and the dosage on that. And then in some places, like, people will murder you to steal that.
Yeah,
It's not worth it. Throw it away.
yeah.
Throw it away responsibly. There's some pharmacies where you can take them for, like kind of dumping amnesty boxes, toss them in there. Much safer.
Yeah, pharmacies usually have something that you can dispose of it, or there's the drug take back events that typically
Mhm.
happen with law enforcement. They typically happen 2 or 3 times a year. Just find out when law enforcement is having those drug take backs and just give it to them, and they will basically destroy all of that stuff for you. So that way you're not like contaminating like the water or anything like that by flushing it down the toilet. That's another terrible
Yeah.
idea because then that gets into our system, right? So
Plenty
don't
of
do that.
chemicals out there in our water system. We don't need that
Right.
too.
Right. I mean, there's all kinds of a mess. Dispose of it properly,
Yeah.
and so that way it's destroyed through drug take back program is great, or the pharmacy. But yeah, get rid of that stuff. It doesn't belong in your house. You're not going to use it. You shouldn't use it unless you have some kind of, like
Yeah.
cancer diagnosis, something like that, that's life threatening. So really, really great conversation today. I've
Yeah.
loved this conversation. Now, if I find myself in that Raleigh, North Carolina
Mm.
area, where you typically tend to be, where should I go for a great bite to eat? Because
All
I'm
right.
all about food.
Coopers. So you'll have some great old school North Carolina barbecue.
Oh, nice.
But yeah, Coopers, downtown Raleigh.
All right, downtown Raleigh. That sounds good. I will hit up Cooper's and I'll let you know what I think. I mean, I'm a Nashville guy, so I know a thing or
Yeah.
two about good barbecue. All right.
Oh yeah.
So we're gonna test it out. We're gonna see
All
what
right.
Cooper's is all about.
Or some fried chicken and waffles.
Ooh,
Mm,
that's nice. Yeah, that's
mm,
good stuff. Now,
yeah.
this might not be good like cholesterol wise, but I'm sure it's really delicious. So there's that.
Yeah.
Everything in moderation, right, Doc?
Yes, sir.
All right. So, if our listeners, if they want to bring you in to speak on their college campus, if they want to go and buy the book, it's called Be the Weight Behind the Spear. Where should they go to connect with you and get all this stuff?
So I got all the social media, LinkedIn, Facebook, and X. And the website is weightbehindthespear.com. So WEIGHT, like a weight, weightbehindthespear.com.
Weightbehindthespear.com, and then go and connect with him on LinkedIn as well. It's Dr. Josh McConkey. That's how we connected over LinkedIn. So I appreciate this, Doc. This has been a great conversation. I know the college students are going to love hearing all about it and reading your book, Be the Weight Behind the Spear. Thanks so much for being with us today.
Yeah, thank you, Mike. Anytime.
All right. And to our listeners, if you enjoyed this conversation with Dr. and Colonel Josh McConkey, I want you to like this. I want you to share it with other college students. And we'll see you on the next episode of the Fraternity Foodie Podcast. Thanks for joining us. We'll see you next time.